Hi guys, welcome back to Empower, and my name is Caroline Porter Thomas. Thank you so much as usual for watching my YouTube channel. This video request was requested from Mighty Nurse. If you guys don't know who Mighty Nurse is, I will put links to their sites below in the description section, but they have a massive Facebook fan page with over 600,000 followers. And they said that this is a video request that they get a lot, and that is for nursing documentation tips. So it was actually kind of hard for me to think about like how I could possibly create a video like that. But then one day when I was at work, I was like, oh my gosh, why don't I just do like a day in my nursing life documentation? So these are the things. Now, I didn't do all of this documentation. Like some things just came to mind and I was like, oh, I want to show them this or I want to show them that. But a lot of this is what I did that day. So I really hope you like this video. And if you want to see more videos like this with documentation tips or a day in my nursing life documentation tips, then do me a favor and give this video a thumbs up. So let's get right into the video. So one of the first things that you want to do as a nurse is learn things that you can abbreviate on ASAP, because you have to document very fast, you have to document a lot, and you want to make sure that it's going to be really fast. And one of the best ways to do that is to learn how to abbreviate everything you possibly can. You don't want to go too crazy because you want the note to be readable. There's a lot of abbreviations that I learned over the years of being a nurse that I definitely did not learn most of them in nursing school. The other tip before we get started is I also want to say, I know a lot of people say this, but you never ever want to show any emotion in your note whatsoever. Think about it like this. Like imagine reading this a year later and you want to make sure that it is like a completely, you're just stating the facts, that's it. There's no like I did this, he did that. It's just like this is what happened. It's like basically using the SBAR format, which is situation, background, assessment, and recommendation, and then outcome. Anyway, so yeah, so you kind of want to use like the SBAR format, but also basically document the evaluation. So these are just kind of as things came to my mind. Just to give you an example, that day I did change a patient's dressings. So this was a note that I wrote the other day. Basically says, change patient's dressings as per MD order by cleaning the left full ulcer with normal saline, packed with moist 1/4 inch iodoform, covered with moist 4x4, and wrapped with Curlex. Patient was given Percocet 1 hour prior to dressing change. See how I changed the dressing to DSG and tolerated well. So that was one note that I did. Oh, so you'll also notice that I use all caps. So then another thing that I wanted to point out is that you always want to abbreviate right and left by just an R period and L period. Another one is BLE, which means bilateral lower extremities. If you put that anywhere, anyone in the medical field will know what you're talking about. Also BIL for bilateral. So that's good to put in your notes. Like if you say bilateral arms. CDI is another one that is really big. I use this all the time, and it means clean, dry, and intact. For example, receive patient from PACU, which is post-surgery. Patient's dressing is clean, dry, and intact. I also abbreviate OINT for ointment. I know these are sometimes like, minute little things, but when you're really in a hurry, every little second counts. And I always put PT for patient. OOB is a good one, out of bed. So you can say assisted patient OOB to chair, which is basically out of bed to chair. HRF is one that I use all the time, which means high risk for falls. I also put spoke with, so S/W, and that means spoke with. And then V/U, verbalized understanding. So that makes more sense if you put it in the note format. So patient verbalized understanding of the NPO order after midnight due to procedure in the AM. So notice I also use AM instead of morning. NPO, nothing by mouth, nothing per oral. I guess that's what it means. And then ADLs, activities of daily living. So Q2 hour, anything that you have like an hour thing with, you can always abbreviate it by like Q, which means every, and then 2, whatever frequency the hour is, and then H for hour. So if you put those like that, if you do Q1 hour, Q2 hour, Q2, Q3 hours, everybody will know what you're talking about. And then, so just for example, I might put this in my like initial nursing note when I'm doing my morning assessment, which is like patient will be repositioned Q2 hours. So this might be in my assessment note, but obviously you're supposed to document real time when you actually turn the patient. And then CO, which means complained of. SOB is a big one that I use all the time. So patient complained of shortness of breath, or SOB. Dr. Smith called and ordered treatments. Respiratory therapist, see how I abbreviated respiratory, just these little things. When you're in a hurry, these will save you a lot of time. Respiratory therapist gave treatment and patient verbalized relief. Sometimes I just put the V to stay verbalized. If it makes sense in the sentence, I will do it. I like to finish most of my notes with "will continue to monitor." It's almost like a period for me. I know know that a lot of nurses don't like it because they're like, well, would you stop monitoring? And I don't know, I kind of just disagree. I kind of like it. Like if I kind of look at it like this, like if I was in a court of law, like, and remember that there's not going to be a lot of other nurses per se that are going to be in the thing. So you want to just show that you're continually monitoring your patient. And then of course using the appropriate, like when you get into like telemetry or something like that, you can always abbreviate the rhythm, like SR for sinus rhythm, ST for sinus tach, BBB for bundle branch block. Here's a note that I wrote the other day. So a patient complained of chest pain. Patient's BP is 143/77, heart rate 78, O2 98%. Patient is currently sinus rhythm on tele, Dr. Smith notified, and sat EKG ordered as well as sublingual nitro. EKG shows sinus rhythm as well. Again, we abbreviated the sinus rhythm to SR. And patient verbalized, remember we also did the V for verbalize, relief. After 2 sublingual, so I abbreviated the SL for sublingual, nitro tablets. We'll continue to monitor because that's what we do, we monitor. Okay, so this was a note that I did the other day, patient extremely HRF. So if you have a patient that's really high risk for falls, I mean, you might even have a patient that has a sitter order and you don't even have the staff to do that. So you definitely want to document really well. Document everything that you're doing. So these are some things that we might just like take for granted that we do, but it's good to just document it, especially in your morning assessment note. So this is a note that I wrote, patient extremely HRF, which means high risk for falls. Patient's room is close to the nursing station, bed is in the lowest position, bed alarm is active, call bell within reach, and family at bedside. Will monitor patient very closely. So that was a note that I did the other day. So here's another note that I did. So patient complained of increased pain to the surgical site assessed, and there is slight redness, no bleeding, and capillary refill is less than 3 seconds, Dr. Smith notified, and pain medication increased, patient verbalized relief, will continue to monitor, because that is what we do, we monitor. Okay, so one thing that I don't know how your hospital is, but my hospital, like, they want patients that have a discharge order to be out within an hour, which it's just not possible. You have to make sure your patient is safe before they go home. So anyways, if they're not though, you need to write a note. So this is a note that I wrote the other day. Patient states that his ride for DC abbreviated for discharge, will not be able to pick him up until 2 p.m. Charge RN notified. So that kind of says that we're trying everything that we can and we're not holding up the discharge for no reason at all. Okay, so this is like, let's say you had a nonverbal patient. I did a nonverbal patient the other day, so I thought this was a good note for you to see. Patient experiencing pain as evidenced by. So as evidenced by, basically you're going to state the facts as to why you believe something is happening. So furrowing of the forehead, squeezing hand when asked if she was in pain, and affected leg shaking. Pain medication given and patient appears calm. Will continue to monitor. Okay guys, like I said, if you would like to see more a day in my life documentation tips, then please give this video a thumbs up. Also, thank you Mighty Nurse for giving me the opportunity to create the video for your fans and subscribers. And everybody who doesn't know Mighty Nurse, they post a bunch of things on Facebook. I get their Facebook feeds all the time and they post a lot of really funny things. So I'm gonna put the link to their social sites below, so make sure you follow them on all their social sites. So alright guys, thank you so much again for watching. And oh, one more thing, I'm also below the video, I'll put a maybe like a Dropbox link to this document just so you can keep it if you want it. Alright, I really hope this video helped you out and I can't wait to see you again soon. I love you so much. Bye.